Tomorrow's an exciting day because I volunteered to be part of the AstraZeneca COVID-19 vaccine trial that we could not be more excited to launch here at UW Health. To really take it to COVID-19, we're gonna beat this, and the way to do that is to have a safe and effective vaccine. So to be part of that solution just feels great and a really proud moment. Our teams have been working on this for months. It is so difficult to have the infrastructure and the right people in place in order to be selected as a site to test something as important as a COVID-19 vaccine. So just tremendous pride here at UW Health and the School of Medicine and Public Health as we try to do our part in putting an end to this pandemic.
How does it feel to be, I guess, are you patient number one here? Physician patient number one?
As far as I know, but with that said, we've been looking at this vaccine for quite a while now. We understand how it's performed in other studies that are published in The Lancet. We understand the safety protocols that are behind it and how it's performed from a safety perspective. So not so much nervous, just kind of excited to be part of this super important trial. So not nervous, just excited to be part of this, and hopefully can encourage other citizens, both here in Madison, but from around the state, to sign up and be part of this solution, volunteer to be part of this phase 3 trial, so that we can not have so much sickness and we can not have so much death from this virus. It's just time to beat it.
That's what your heart tells you. It is. It's time to beat this thing. And if a physician has to be the first patient, I think then so be it, right? I mean, you're ready to see it over.
I'd like to think that if people see me get the vaccine, I've been in the thick of coronavirus since it started. I've been talking to our experts about vaccines, about different treatments since the beginning. I've reviewed the literature, and I feel that this is a safe vaccine to get as part of a phase 3 trial. So that we can prove that it's safe and effective for our whole community, for all of our citizens. If people can see me get it, I hope that makes them think, you know what, I'm going to be part of this solution too. I'm going to sign up and I'm going to get this vaccine as part of a phase 3 trial.
Anything that you're having to do before you get this, eat a different diet, I don't know, anything, are you just going in strong tomorrow, and just prepare to roll up that sleeve?
Yeah, so there's definitely the consent process. There's the screening process. They have to screen to make sure that I don't have health conditions that would put me at a risk that would not be reasonable to take. And then I'll need to consent. They need to make sure that I'm going to be around for the follow-up appointments because they're going to study this longitudinally, not only for a short period of time, but for up to 2 years to see how does my body react. Will I make those neutralizing antibodies, those killer T cells? What other impacts might it have on vital signs or other lab parameters? So a lot of work that has to be kind of tidied away before we get the injection. But hopefully sometime tomorrow I'll receive my injection. I've got a 67% chance of it being the actual vaccine, a 33% chance of it being the placebo, and both are equally important because we want to show that people who get the vaccine don't get COVID-19, and people who do not get the vaccine or get a placebo can get COVID-19, and that's how we show efficacy. That's how we'll know that the vaccine works.
Wow. And along those same lines, how does your family feel about you doing all of this? Are they excited for you?
I think they're excited. I think, anytime you say you're participating in a clinical trial, there's, initial apprehension. But I think they understand kind of where I'm coming from and why I want to be part of this and why I want to make a difference when it comes to this pandemic and trying to get us into a better place. So largely they're very supportive.
And I'm just thinking, as a physician, how nice would it be to not have to necessarily, I know there's always that chance that you could still get COVID even if the vaccine does work, right? But to know that you have that protection when you're going around despite all your PPE and everything.
It's true. No, I'm not afforded that with the phase 3 trial because I will have no idea whether I got the vaccine or a placebo. So for me, in my everyday life, working in the emergency department or flying on med flight, I'm still going to use that PPE. I'm still going to socially distance. I'm going to wear my mask. Nothing's going to change. But hopefully, when we enroll thousands or 30,000 people and we understand if this vaccine works or not, the day will come where people won't have to worry about wearing a mask and they won't have to worry about socially distancing. We can send our kids to school without worrying if they're going to get sick or make us sick. We can watch the Badgers play football or the Packers up at Lambeau Field. There's just so many good reasons that we want this vaccine to succeed.
Oh, I probably have plenty with that. That's perfect.
Coping wise, I think we're doing just fine. I work with the most tremendous team in the Office of Clinical Trials. They coordinate everything. They make sure that the paperwork is done. They fix all of my mistakes. And they are absolutely the best in the business. And they're the reason that we can bring all of these to fruition.
Absolutely. And you are working on this phase 3 trial that has been in the works for how long to bring into fruition?
A little over a month and a half, probably. I think we were contacted about 7 weeks ago. And then there's the feeling out process between AstraZeneca and University of Wisconsin with a couple of interviews. And then you get selected, but that doesn't mean you'll be activated. And so we waited out the activation period. They decided that University of Wisconsin was exactly the type of university that they were looking for to help initiate a study like this. And we're lucky enough to be one of the first sites to be activated in the United States.
How surprised were you? Or maybe you weren't. I mean, UW is clearly leading the way in advanced research, right? I mean, so talk to me a little bit about that.
Yep, I wasn't surprised at all. I know the quality of people that we have here at UW Health and in the medical school as well. We have the best in the business. We can take a trial and do it the right way so that in the end we have a product that is safe for everybody, effective for everybody. This is a hospital system. This is a team that's committed to getting this trial done right. And so that in the end, we're very confident that we know that this is a vaccine that will be a vaccine for the entire population.
This is, I'm trying to remember, Operation like Turbo Speed. I mean, this is probably one of the fastest phase 3s you've probably ever been a part of in your professional career, I would imagine, right?
So this is funded in part by Warp Speed. The speed with which the vaccine has been brought to this point, I don't think should scare people. It's gone through every single phase as it's supposed to, and they've all been done in the correct fashion. The number of resources and the amount of money that has been funneled towards finding a vaccine for COVID-19 is unprecedented, and the effort that it took to get here, while fast, has been absolutely excellent and scientifically sound.
Wow. And talk to me just a little bit about how pleased you are that the Chief Safety and Quality Officer is going to be the first one to roll up his sleeves here to give it a go.
Well, we feel very fortunate that the face of the pandemic here for UW Health and the School of Medicine and Public Health has agreed to volunteer and to give us his arm so that we can put a vaccine or a placebo in there and have him be study participant number 1. Hopefully, the public that tends to love this guy will see it and be encouraged that they can go ahead and get this vaccine or be part of this trial as well.
Absolutely. And I know we had mentioned eventually we'd like to enroll thousands in this over the next several months. What's that going to look like timeline-wise?
So we want to enroll about 250 participants each week for the next 8 weeks. The trial from the first injection tomorrow until its completion will be 8 weeks long. We hope to do about 50 participants a day. And if we get more participants than that, we'll just keep going until they tell us to stop. We have a community that is very gracious in terms of being willing to volunteer for trials like this. This is an opportunity to give back to the world, really, and to produce something that will be hopefully the next step towards getting back to a normal life.
Yeah, giving back in the best on Wisconsin way ever. Are you guys, I know that other universities are going to be kind of jumping on board here soon too, right? So you're probably kind of like, I don't know, the bat phone at this point. I don't know, what's that kind of like?
So there are other universities that will jump into this. The total study will have about 30,000 participants, both in the U.S. and in a few other countries as well that will contribute to the population pool so that we can study as diverse a population as possible and make sure that this is a vaccine that works here in Wisconsin, works in Florida, works in California, works in Brazil.
Amazing. And my final quick question, I'm just thinking about this off the top. I know that you want to enroll so many different walks of life and individuals. Are you going to keep it at first to just healthcare workers, or is this running the gamut of individuals you'd like to see receive the placebo or the real vaccine trial?
No, the enrollment is open to the public. And so initially, we're enrolling people 18 to 55. Hopefully there'll be, the hold on that will be lifted soon so that we can get the elderly population enrolled as well. About 25% of the enrollees have to be older than 65 eventually, so we will get those subjects into the study. But this is open to everybody. Everybody should have the opportunity to participate if they want to. We'll figure out a way to help you do that.
I love it.